Thank you, Dr. Seriga. Good evening, good afternoon, and good morning. This is the 1929th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NIRAV GANATRA. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again, and you can subscribe the same without paying any money, and you can share it with your friends so that the purpose of the forum is homeopathy, to take homeopathy to every home around the world. And so far, we have uploaded more than 3,000 videos in YouTube, and we have more than 7 lakh views on videos. And let me come to today's guest. As you all know, today our guest is Dr. NIRAV GANATRA, and Dr. has completed MD and is working as the Department of Organon of Medicine as a dedicated academician and researcher, currently serving as research coordinator, NIBH coordinator, and assistant professor in the Department of Organon of Medicine at L.R. Shah Homeopathy College, Gauri Vidyapeeth. He has an extensive academic portfolio comprising multiple national and international paper presentations, poster presentations, and scientific publication in UGC-approved and peer-reviewed journals. He has been actively involved as a reviewer for reputed journals and has contributed significantly to the institution's research activities in interdisciplinary collaborations and evidence-based advanced homeopathy. With a strong commitment to clinical research, policy assurance, and student mentorship, Dr. Ganatra continues to advance the scientific understanding of homeopathy through innovative studies, scholarly discourse, and active participation in professional reforms. Dr. Nira has presented so many brilliant presentations in this forum, and today Dr. will be talking about holistic health through keynote prescriptions, integrating classical homeopathy with modern wellness. So we proudly welcome the guest of the day, Dr. Nira, to this session. Welcome, Doctor.
Is it now visible?
Yes, now it is visible. Everything fine. You can make it large, big screen. Yes, okay, fine. Go ahead.
Okay, so today's our topic is based upon the very need of an hour, which we can see that at present, most of the people think that uh, homeopathy and homeopath takes a lot of time in taking a case, and at present people always feel that it should be done within few minutes, within few time, and nobody is wanting to give their case for long period of time, for hours and hours. We can also see that individualization and all the point of view, the principles of homeopathic system of medicine, to explore them, to explore the individual suffering from a particular disease, takes a time. But in the cases where the patient itself is impatient, or where the case is totally clear in front of us, instead of spending lots of time into it, we may be prescribing on the basis of the keynotes available with us. So today we are going to explore that how keynote prescribing is important, how keynote prescribing is helpful to us in today's era. So the topic is holistic health through keynote prescribing, integrating classical homeopathy with modern wellness. So holistic health focuses on treating the whole person, mind, body, and vitality rather than just isolated symptoms. When we are talking about keynote symptoms, we are not meaning that we are talking about just few symptoms taking into the consideration and just taking the case. We are going to take those keynote symptoms which are going to helpful to make totality of the symptom. To prepare that totality of symptom just with the help of a few keynotes would be helpful to identify the patient person which can be useful for the particular type of the prescription. So instead of taking only few isolated symptoms and giving a therapeutic prescription, we would be focusing on preparing a totality based upon few of the PQRS and keynote symptoms, which would be taking onto the grand generalization aspect as given by Dr. Boning Hussain and taking the individualistic approach in treating the patient, which can be already seen in the second point. Classical homeopathy aligns closely with the holistic medicine as it prioritizes individualization and the inner healing mechanism. Keynote prescribing offers a practical bridge between classical homeopathy and the demands of the modern wellness practice. What is modern wellness practice? What is keynote prescribing? And what is classical homeopathy? That we are going to explore. This trio will be explored in this today's session. Homeopathy, as we all know, is a holistic science confirmed experimentally and clinically based upon the individual aspect of the inductive logic, where we follow the four steps of exact observation, clinical experimentation, scientific construction, and logical reasoning also. Homeopathic medicine boosts self-defense mechanism of the body and thereby reduces the frequency and severity of the subsequent attacks without any kind of side effects, and also eliminates drug dependency to establish health. Scope of conventional treatment is very limited in cases of respiratory disorders and various other disorders. Why I am focusing respiratory disorders today over here is as we are going to see few of the clinical aspects where keynote symptoms of the respiratory complaints of a few patients have been cured with the help of just keynote prescription. So, as we are knowing about the holistic approach based upon the keynote prescription, moving further, holistic health encompasses physical well being, emotional and mental harmony, lifestyle, diet, and stress balance, environment, and socio-spiritual support. Whereas modern wellness system integrate functional medicine, nutrition science, mind-body practices, including yoga, meditation, breathwork, and preventive lifestyle interventions. Where homeopathy is focused upon the physical well-being, emotional and mental harmony given by holistic health, along with the lifestyle, diet, and stress balance, environmental and socio-spiritual support will be bridged by the requirements of the modern wellness, which is based upon the functional medicine, where they are appropriating, or we can say, the modifying the physiological aspect of the human organism, the nutrition science, which would be carried by the diet and lifestyle balance, mind body practices, yoga, meditation, breathwork, preventive lifestyle interventions. In homeopathy, following modes of prescription have been focused upon: constitutional prescription, second, based on ailment factor, keynote prescription, intercurrent remedy prescription, and anti-miasmatic prescription. What happens in the constitutional prescription where we take the whole case, where we are going to identify that how and what response has been given by the patient in the particular type of situation, according with taking into the consideration the pathophysiology, the pathogenesis of the disease, and then carrying forward to the prescription, where we are exploring the constitution of the patient and giving the individualized homeopathic remedy. That is particularly that the constitutional prescription. Second, based on the ailment factor, where we are focusing upon the just causative factor. Cold, because of the draft of cold air. Patient suffering from the respiratory complaints because of draft of cold air. Weakness, because of loss of vital fluid. Depending upon the ailment factor. Respiratory complaints by eating ice creams, taking milk, cold drinks, cold food. Depending upon the ailment factor, when the remedy is being selected, when the remedy is being prescribed, then it is known as the prescription which is based on the ailment factor. Third, that is the keynote prescription which we are going to explore in detail in our today's session. Fourth, intercurrent remedy prescription. When after taking a whole length case, after the constitutional prescription, the remedy does not give the expected result, when the patient does not get the particular type of, we can say, the result, when patient does not show any remarkable effects, good effects, or remarkable result into it, then comes the role of the intercurrent remedy prescription, where we are providing intercurrent remedies for removing the miasmatic block from the patient's condition being worsening or on the status quo position. When the health of the patient is not improving, when there is status quo position, the intercurrent remedy prescription comes into the role. And the last, that is anti-miasmatic prescription, where we give the anti-miasmatic remedy according to the presenting symptoms of the patient and evolution of the disease, depending upon the miasmatic development into the patient, anti-miasmatic prescription has been taken place. What is keynote prescription in homeopathy? It is generally misconceptualized with the therapeutic prescription. Keynotes are the most characteristic, striking, peculiar features of a remedy, where we are going to discuss few of the remedies and their keynote symptoms also in this session. Often mental or emotional or general symptoms, not merely just local complaints. Fever without thirst, that is a striking peculiar feature of particular remedy. Problems all being started with the loss of or the death of the loved one, mental or emotional aspect. When any kind of incident takes place where teacher just slams the person student in the whole presence of whole class, the student feels very disgraceful, disrespectful, and in turn some kind of pathology develops into the body of the student. A single rubric of getting being disrupted, disgraceful, would be the keynote symptom for the prescription. No any kind of another full case taking or full length case is being required. Single keynote is helpful for the prescription of the remedy. Quick pointers that lead patient from expression to the remedy core. If we see the remedy core of if we take the example of the periodic table, the first group of medicine, second group of medicine, third group of medicine, all the period wise particular remedy core are being explained. For example, potassium period, Kali period, the third period, responsible patients. The patient just when talks about it, you will get a core of being responsibility. That responsible, that remedy core will be the patient's expression in the whole case itself. So quick, that would be the quick pointer for us for giving a prescription. Simplifying the keynotes, it will help in remedy selection in busy modern practice. Acute prescribing, when there is acute disease, we all know we do not take whole length cases. We will just be providing on the basis of few keynote sign and symptoms. Just like we saw that fever without thirst, that is particular in acute prescribing, weakness because of the loss of vital fluids, acute prescribing, you can say the respiratory complaints, cold and coryza because of the exposure to the cold air, draft of cold air, integrating classical principles in real-time clinical settings where we are giving prescription on the basis of PQRS. If we see the definition of the totality of symptom itself, it suggests that it is the logical sum total of the symptoms. Logical sum total means where we are taking into the considerations about the regarding the PQRS symptoms, the characteristic symptoms, the uncommon rare symptoms into our totality. So this keynote will help us integrating all our classical principles which are given by Master Henneman in the organon of medicine into the real-time clinical settings. Characteristic keynote prescription in homeopathy. Now here we are going to discuss various viewpoints of the various philosophers given by the homeopathic stalwarts in accordance of the keynote prescription. H. N. Guernsey is being credited to be the founder of this method of prescribing. But in reality, this was been practiced even before that. But Guernsey came with this aspect, came with this thought of keynote prescribing. According to Dr. Stuart Close, Guernsey simply invented a new name for the old Hahnemannian idea. In section 153 of Organon of Medicine, Master Hahnemann says that in comparing the collective symptoms of the natural disease with drug symptoms for the purpose of finding the specific curative remedy. The more striking, singular, uncommon, and peculiar, that is the characteristic sign and symptoms, all these adjectives, all these characteristics which have been discussed about the sign and symptoms are identifying or we can say defining the keynote prescription in the homeopathy. The more striking, singular, uncommon, and peculiar characteristic signs and symptoms of the case are chiefly and almost solely to be kept in a view. For it is more particularly these that very similar ones in the list of the symptoms of the selected medicine must correspond to. That is, we are establishing the symptom similarity between the keynote symptoms and the keynote of the natural disease and the keynote symptoms of the homeopathic remedy. So, keeping it into the view, in order to constitute it the most suitable for effecting the cure, the more general or common and undefined symptoms, just like loss of appetite, headache, debility, etc., demand but little attention when of that vague and indefinite character, if they cannot be more accurately described as symptoms of such a general nature are observed in almost every disease and every drug. So, though they are general, common, and undefined symptoms, the vague symptoms which we talk about, still they need to be identified or they need to be addressed. Why? Because the specialization, we can say the any kind of additions into their adjectives, that is loss of appetite because of the ailments from the death of the loved ones, headache because of the sun exposure, headache because of the heat of the gas stove, adds the peculiarity, adds the characteristicness into the sign and symptoms, which makes it the keynote. And this keynote would be helpful in the prescription. And the prescription based on these keynotes obtained in a very less time would be helpful in our homeopathy to explore the hope. This seems sufficiently clear description of what Honeyman meant by characteristic symptoms, and yet the term has been the subject of much discussion, and many have differed as to what constitutes a characteristic. So, characteristics are more striking, singular, uncommon, and peculiar sign and symptoms. These are nothing but the keynote symptoms of the disease. These keynote helps in construction of the totality of symptoms and also helpful in identifying the prescription of the patient. Dr. Kent discussed many of his cases in his lesser writings or those published from time to time in different journals, in which he criticized the keynote prescribers on the one hand, and yet he used keynotes all the time. If we see Dr. Kent's approach, it was almost on the basis of the psychosomatic aspect, where they were required to be giving up the patient's core mental aspect into the physical aspect, where they were approaching the patient's all the complaints depending upon to the patient's mental aspect. But in the development of the Kent's repertory, clinical approach, or we can say the clinical confirmation of the sign and symptoms, the specificity of the Kent's repertory has come on the basis of this keynote prescription itself. So Kent's use of keynotes is very much rational, and in fact, he was giving more concrete support to the system when he was using keynotes, which represented the general state. Later, Dr. H.C. Allen emerged as a big advocate of the system of prescription of homeopathic medicines on the basis of keynote prescription and gave it much popularity through his book Keynotes and Characteristics with comparison of some of the leading remedies of the materia medica. At present, we are having that Allen's keynote book as reference to the prescription in many of the cases as a all-time referred book, even by the students of the materia medica, the students of the BHMS course, as their source book, as their textbook to understand and identify the keynotes of the homeopathic medicines. Dr. Allen, for the first time, joined the two terms, keynotes and characteristics. There appears to be slight difference in his approach and application. Allen meant to use keynotes more for comparison and differentiation of the remedies. That is, if we look at into the book of Allen's keynote also, wherever there are keynotes being explained, at every place there is a comparison with one of the other remedy. Urticaria with itching, urticaria without itching. Loquacity with delusion, loquacity without delusion. Fever with thirst, fever without thirst. At every place, the remedy comparison and the remedy differentiation has been explained. In the preface to the first edition to his above mentioned book, he said that so-called keynotes are pivotal point of comparison. Even Morgan called keynotes as super characteristics and said that they are almost always found in the cases cured by that drug. So keynotes are very important point of view, are very important part of the homeopathic system of medicine, where they are not just important for therapeutic prescription, but they are also important for the whole identification of the individual suffering from the particular type of the disease, which was emphasized by all these stalwarts of a homeopathic system of medicine. Thus, the keynote is the characteristic feature of a case of a disease. This characteristic feature helps us in the construction of the totality of symptom. And this totality of symptom based upon the keynotes helps as a successful prescription. These are the features that give the disease case its individuality, which in turn are related to an act of thought based on the totality of symptoms. If the totality of symptom would be constructed of more common or general symptoms, it was not going to give a successful prescription, nor it was going to give a particular type of the keynote prescription, which would be helpful in the case of the curing the disease. But when these keynotes are being explored, it adds the characteristic feature to the common symptom. And that common symptom, after being added with the keynote characteristic feature, helps in identification of the individuality of the disease. Hence, that in turn helps in the construction of the strong totality of symptom, which is helpful for making the successful homeopathic prescription. As Dr. Stuart Close has stated it, a characteristic or keynote symptom is a generalization drawn from the particular symptoms by logical deduction. Here we are going to take into the consideration inductive logic as well and the deductive logic also. By the help of the deductive logic, we are getting the keynote symptoms. And when these keynote symptoms, when these particular premises are being gathered all together and according to the basis or the principles of the inductive logic, all these particular premises generates a grand in general premises. So this grand generalization, which is drawn from the particular symptoms by the logical deduction of inductive as well as deductive logic, helps in a successful keynote prescription. Obtaining the keynote symptoms with the help of deductive logic, taking all these types of uh, aspects, gathering it into the particular way, and taking into the consideration of a grand generalization, constructing the totality of symptoms on the basis of these keynote symptoms helps into the keynote prescription by inductive logic. So logical deductions helps, both the type of logical deduction helps in the keynote prescription. First, deductive logic for identification of keynote symptoms, inductive logic, gathering all the keynote symptoms and giving a particular type of successful keynote prescription. Integrating keynote prescribing with modern wellness, functional and nutritional medicinal integration. Recognizing the nutritional deficiencies that mimic remedy features. For example, sepia medicine has been given the name of homeopathic vitamin B12. Why? Because most of the characteristic features which are being expressed by the vitamin B12 deficiency in the organism matches totality with the drug disease produced by the sepia remedy. So the sepia, that's why it is being termed as homeopathic vitamin B12. Why? Because the nutritional deficiency disease produced in the organism is being correlated with the artificial drug disease produced by that particular remedy. So the keynotes of that particular remedy matches with the nutritional deficiency disorder and helps in the successful keynote prescription. Integrating homeopathic remedy with anti-inflammatory nutrition, gut health protocols, detoxification support. This was according to, or we can say, regarding the bridging between the functional and nutritional medicine. Mind body integration, remedy for emotional stress combined with breath work. That we can say, for example, in the cases of where asthmatic asthma, which is being developed because of the any psychological disturbances, asthmatic attack, acute asthmatic attack because of the restlessness, because of the burst of the suppressed anger. All these emotional stress combined into the breath work. Mindfulness techniques. Mindfulness techniques here means about dealing all the emotional stresses with mindful strategies, where if a patient becomes impatient, we help them by counseling process CBT, that is our counseling support. In this counseling based treatment, CBT is nothing but counseling based treatment, where the patient is being approached by the process of counseling, and this counseling based treatment helps in the keynote prescription. For these support, this counseling helps in developing particular type of basic support for the patient in giving up the process. Remedies for emotional stress combined with breath work, mindfulness techniques, CBT, or counseling support. Lifestyle medicine, homeopathic acutes plus lifestyle corrections. For example, in the case where we see acute condition because of the deviated lifestyle, for example, not properly sitting and then developing a backache. In that case, we can give acute homeopathic remedy associated with the lifestyle correction. Remedy support during habit change, sleep, exercise, circadian health, all these would be benefited with the help of the remedy support itself. For example, indisposition, where we need slight change in the diet and regime of the patient, then being supported with the remedy. This sleep, exercise, circadian health, all these would be helpful with the support of the homeopathic remedy. Integrative case taking, where includes the wellness parameters, stress level, sleep quality, diet pattern, emotional health, environmental triggers, all these need to work, taking each and every aspect into hand to hand. Wellness parameters, that is the stress level. These stress level has been developed of any kind of the reason, but would be balanced with the help of the successful homeopathic prescription. This successful homeopathic prescription, when given up on the basis of the keynotes, on the keynote where the stress because of what, expressed with what, will be helpful into the keynote prescription. The cause and expression aspect of a keynote would be helpful in this case. Patient becomes quiet, patient withdraws itself from all the kind of the social aspect because of the suppressed anger. A single keynote of suppressed anger because of indignified aspect. Keynote prescription for staphysagria. Aloof, abandons itself, loneliness because of the death of the loved one. A single keynote for the depression or the stress level of the emotion, improving the emotional health of a patient by giving just natrum muriaticum, ignatia, the keynotes of a particular diseases, emotional health, and environmental triggers. Environmental triggers, like just as we discussed about, giving a medicine in the case of the respiratory illness, cold coryza because of the draft of the cold air, conite, any kind of blow injury into the eye, sudden development of the redness, symphytum, belladonna, arnica. Because of this keynote prescription, it will give a very rapid result to the patient, where they do not have to wait for hours, for the days to get the result. Clinical scenarios where keynote prescription or is indicated not only helps, but it is strongly recommended. First, where acute fevers are in the case, rapid decisive remedy selection is to be done. We all know that if acute fevers are not treated, these fevers are going to get converted into a very serious condition and development of sometimes brain fag, and very serious illnesses developing from the acute fevers. So here, very rapid and decisive remedy selection is needed. Second, emotional traumas. Identify the strong keynote-based mental states, how the patient is reacting in particular type of the situation, how the patient is being affected due to the particular type of the symptoms, would be helpful in balancing or managing the emotional traumas. Allergies and respiratory issues. Coryza, cold cough because of the allergy of particular type of the allergen or the pathogen, helps in clearing the modalities. It suppose again the keynote based prescription. Lifestyle related disorders, where in the case if we see stress, sleep disturbances, digestive issues, and all. So these are, we can say, the utmost cases where the keynote prescription is very much of the use. Acute fevers, emotional traumas, allergies and respiratory issues, lifestyle related disorders. Few of the myths are there regarding the keynote prescription, where it is being misconceptualized with the therapeutic prescription. Keynotes replace totality. No, not at all. Keynotes are the way, they are the compass. They helps the direction or they gives the guidance to make a totality of symptoms. Not only on the basis of two to three keynotes, but constructing the totality based upon those keynotes will help us in the give a particular type of a successful prescription. Keynote second myth is keynotes encourage shortcut prescribing. Not at all. It is a time saving method of the prescription where there is urgent requirement of medicine administration. In the cases where the patient's individualization is to be explored at a par, at a depth, in those cases, keynote prescription is totally contraindicated. But when used correctly, keynotes always preserves the classical principles while enabling the efficiency. Myth. Keynotes are only for the acute cases. In the chronic cases itself, in the chronic cases also, we can say identifying the pathology of the patient, how that pathology has been developed on the basis of this keynote will helpful in the successful keynote prescription. Deep constitutional remedy often contain clear keynote features, which we are going to explore in the further slides. That is first, aconite. Key essences, development of any kind of disease suddenly and the violent onset. Each and every pathological aspect associated with fear of death. If we see the keynote in the mental picture, that is extreme restless, try of restlessness, it is being included into panic after shock or frightful condition. Physical keynotes, sudden high fever, very dry and hard cough. Modalities, worse in midnight, cold air, shock, better into the open air. Clinical use into the acute fevers, panic attacks, sudden respiratory complaints. Arsenicum album. Key essences. Arsenic is dependent upon the three key words itself. That is anxiety, restlessness, and weakness. Profound debility because of the particular types of the condition. Restless, though weak, but restless. And along with it is anxiety. Mental picture, health anxiety, fear of being alone. Physical keynotes, burning pains, but desire warm drinks. Thirst for frequent sips. Modalities, worse, midnight 2 a.m. and better by warmth. Clinical uses in asthma, gastritis, influenza, anxiety conditions. Belladonna, key essence is sudden and intense congestion, redness all over the body. Mental picture, irritable, delirious. Physical keynotes, highly keynote feature is throbbing pains, dilated pupils, high fever with red face. Again, as I said, congestion all over the parts of the body. Words, light, noise, touch, slightest light, slightest noise, slightest any kind of stimuli. is very disturbing for the belladonna. Clinical use in acute infection, migraine, tonsillitis. Bryonia, key essence is dryness. Dryness into the mental aspect, dryness into the physical aspects. Want to be left alone, dry, does not want to mingle with any kind of people. Physical keynotes, dry mucous membranes, splitting headache, modalities, worse slightest motion, and better by pressure or rest. Clinical use, bronchitis, pleurisy, dehydration related symptoms. Pulsatilla, key essence is mild VP, 6 consolation, mental picture, changeable moods, physical keynotes, thick, bland, yellow green discharge, no thirst. Modalities, worse, warm rooms, better open air. Clinical use again, respiratory infections, hormonal problems, digestive upsets. Nux vomica, key essence is irritable bowel syndrome, irritable oversensitivity, type A personality, total businessman type quality, high society quality, type A personality. Mental picture, frustrated, impatient, physical keynotes, gastrointestinal spasms, infectious urging, modalities versus overwork, better by rest or warmth. Clinical use in stress disorders, acidity, hangover symptoms, ignatia, key essence, ailments from grief or disappointment. Mental picture, silent grief, contradictory behavior, physical keynotes, globus hystericus, lump in the throat, cannot speak because whatever the kind of the mental aspect is there is being stuck into the person's mind. That mental aspect is being physicalized, somatized as a globus hystericus like lump in the throat. Modalities, worse emotions, better by distraction. If any kind of emotional aspect is going on into the mind, any kind of hurt is there, that particular thing is going to be picking up into the person's mind. Better by any kind of distractions. Clinical uses, psychosomatic complaints, grief reactions, Kalibich, key essence, stringy ropey secretions of all the secretions. Stringy ropiness being seen into the all the kind of secretions. Mental picture, irritability with heaviness. Physical keynotes if we see thick glue-like nasal or bronchial mucus. Modalities worse or worse in cold weather, better by heat. Clinical use sinusitis, chronic cough, post-nasal drip, phosphorus, key essence, open, sensitive, impressionable, mental picture, fear of dark, thunderstorms, physical keynotes, bright red bleeding, burning sensations, modalities, worse evening, better cold drinks. Clinical use in hemorrhage, respiratory weakness, and anxiety. Spongia tosta, key essence, dry barking cough. Mental picture includes the anxiety with breathing difficulty, physical keynote, dryness everywhere. Modalities worse before midnight, better warm drinks. Clinical use croup, dry cough, cardiac cough. Hepar sulf, key essence, extreme sensitivity, both physical and emotional. Mental picture, irritable, easily offended. Physical keynotes, thick yellow mucus, splinter like pains. Modalities worse cold air, better warm. Clinical use in bronchitis, tonsillitis, and suppurative tendency into the all the types of the disease. Entim-tart, key essence is rattling cough with difficult expectoration. The whole chest rattles with this rattling cough, rattles with this cough. Mental picture, weakness, drowsiness. Physical keynotes, rattling in chest, desire to be carried in by children. Modalities, worse, lying down, better sitting up. Clinical use is bronchopneumonia, COPD exacerbation, asthma, etc. Carbovage, the key essence is the low vitality and the desire for air. Continuously fanning is required. Anxiety of the suffocation, physical keynotes, cold, clammy body, wants fanning. Modalities, worse, lying flat, being fanned. Clinical use, respiratory failure tendency, collapse, bloating, sulfur, key essence, heat, burning, philosophical thinker. Mental picture that is theorizing, egoistic, lazy for hygiene. We see ragged philosopher physique, burning souls, heated vortex, modalities, worse morning or standing, and better by open air. Clinical use of feces, that is skin disorders, chronic respiratory issues, and gastric disorders. Tuberculinum, that is having the key essence of restlessness, desire to roam, and recurring infections. Mental picture that is discontented, irritable, physical keynotes, repeated colds, bronchitis, weak chest. Modalities contain worse in cold, change of weather, better outdoors movement. Clinical uses for recurring respiratory infections, allergies, and weakness of the lungs. Here I have been taken the aspect of the case taking regarding into the keynote description, but not going to into the depth of it. We will be moving as the time is less, so I'm moving over to the case aspect. I have discussed over here few of the cases. First case, that is patient came to the clinic with his child having complaint of थोड़ा सा भी चलने या दौड़ने से या फिर काम करने पर बहुत तेज खांसी उठती है। खांसी इतनी जोर से आती है कि एकदम सांस फूलने लगती है, गहरी गहरी सांस लेनी पड़ती है। जब सांस लेते हैं तो ऐसा लगता है जैसे सीटी जैसी आवाज आती है।
Sir,
चेहरा
sir,
बिल्कुल
sir,
फीका पड़ जाता है।
better to say the translatory part. Otherwise, we may not be able to understand what you're speaking because the
Okay,
Hindi
I'll
is,
just take it onto the keynote aspect itself.
yes, yes. That's enough. That's enough.
Yeah, sure, so that we can complete into the time also. All these keynote have been taken place into the interpretation. All the whatever the keynotes were obtained from the previous case, that was coughing, aggravation by least exertion, violent dyspnea, difficulty in breathing, wheezing while inspiration, vomiting of the cough, rattling of cough on inspiration. The patient was sensitive to cold, and there was intermittent fever. If we see all these keynotes are referred in our homeopathic materia medica of Allen's keynote as such. Sometimes we see that we feel that how patient would be saying the keynotes which are being explained into the materia medica. But when we see into the clinic, their patients are speaking particularly and that particular language which has been explained in our materia medica. Here are those particular types of the symptoms which I observed into this case. Constricted, if you see constricted, dry, spasmodic, asthmatic, difficult breathing from least exercise, violent dyspnea with wheezing and anxiety about the stomach, whooping cough, child loses breath, turns pale, stiff and blue, strangling with gagging and vomiting of the mucus. Bleeding from nose or mouth was not observed, but cough with rattling of mucus in bronchi when inspiring. Threatened suffocation from mucus. An intermittent fever in beginning of irregular cases with nausea or from gastric disturbances. So Ipecac was given to the patient, and within 2 months complaint was resolved itself. Second case is during the spasmodic attack of the coughing, lots of cough was being expectorated out, and we can say very sticky or stringy cough was there, or which was green in color. I am just translating whatever is given over here, and it feels that the cough is already stuck into our chest. In the morning, it is accompanied with very strong coughing, and with the help with during that coughing, it is being difficulty in breathing with the patient. During the attack of the cough itself, headache also starts with the patient, and it starts with the occipital lobe, and then it takes place into the whole head itself. If the patient sleeps again, then it is being okay with the patient, and the condition of the course, cough, which was worsened, was also gets ameliorated. Extreme uh, coughing leads to the burning into the throat itself. So sometimes, due to the dyspnea, also the patient's voice gets disturbed, and sometimes that the loss of voice because of this extreme coughing. From all these, we can interpret before a week it was quite hot weather. So we can take complaints, aggravation in hot weather, dyspnea, aggravation in morning, on awakening, and amelioration by lying down. Violent coughing with stringy greenish discharge, which develops hoarseness of voice into the patient, rattling of cough inside the chest, and has violent pain from the occiput to forehead. All these things are being given word to word in our Allen's keynote as a discharge of tough, stringy mucus which adheres to the part and can be drawn into the long strings. Clinkers, tough, ropey, green, fluidy mucus in clear masses, violent pain from occiput to forehead if discharge eases. Cough, violent rattling with gagging from viscid mucus in the throat. Aggravation in morning or in awakening, and amelioration by lying down. All these are being, we can say, the keynote symptoms, and these keynote symptoms helps into the help successful prescription. Third case of the cough itself. The cough uh, starts so vigorously and violently that it lasts for minimum 1 minute itself. In the daytime, it is being less, but as we can say, here they have given a peculiar symptom that when it becomes evening time, then it starts being so much aggressive, so much like it's continuous, that it feels like some war has been started inside the patient's chest, and the cough is being coming out like gunshot. And that is most probably seen into the night itself. During, if patient starts continuously laughing, then again coughing starts. In because of this, the patient has started being irritable and angry. Keynotes which were seen: whooping cough with violent paroxysm, which follow each other rapidly; minute gun cough during the day, whooping at night; spasmodic with gagging, retching, and vomiting; nocturnal cough of young person; constriction and crawling in larynx; hoarseness; yellow-green sputa. Again, which is directly given as keynotes into the Drosera rotundifolia, and on the basis of this totality of symptoms, constructed on the basis of keynote symptoms, was given and better follow-up was obtained. Fourth case, where 30-year male patient came working into the shipyard, came with the complaint of recurrent attacks of the dyspnea, breathlessness, and coughing. Again, he also complained regarding all the complaints started after the pneumonia, when he's lying on the bed and then arises or awakes. Then the coughing starts and leading to the breathlessness and dyspnea. Along with the coughing, there is a sharp shooting pain inside on the chest, and during the coughing, the patient needs to hold the chest, otherwise, it is very painful. Again, here the coughing or expectoration is greenish in color. Why I have chosen these cases, where if you see in all the three cases there was green cough or green expectoration, but in all the cases the remedy prescribed was different, because all the keynote symptoms are being taken into the consideration for constructing the totality of symptom. Here, the keynotes were dyspnea, desire to take a deep breath during damp; sputa, green, greenish, copious. During cough, has to sit up in the bed and hold the chest with both the hands. Always worse in damp and rainy weather. Natrum sulfuricum was given as we saw that the patient was working in a shipyard. So dampness of weather is being always seen over that damp houses or cellar or like that way. Patient feels very changed from dry to wet, cannot tolerate sea air. Dyspnea, desire to take a deep breath during damp, cloudy weather. Great soreness of the chest, has to sit up in bed and hold the chest with both hands. Again, here also we can see they have given us the comparison with the keynote of nitric acid and bryonia. So, designing a holistic treatment plan with components of remedy, lifestyle guidance, nutritional support, emotional regulation tools, environmental correction, follow up parameters like sleep, energy, and mental clarity. Challenges and solutions because of the keynote prescription with the challenges which we are facing and the probable solutions which we can take it upon are challenges over reliance on the keynotes alone. If we find the keynote prescription as to be the most successful one, then it becomes over reliance over to the keynote symptom itself, misinterpretation of the keynote symptom sometimes, inconsistent case taking, because if we depend upon more over to the keynote symptoms, then we can say it becomes, it takes the patient or it takes the person to always conduct this kind of case taking and avoid the in-depth case taking. Then time constraint and modern practice. Solutions are combining the keynote with the totality, integrate repertorial confirmation, use clinical protocols wherever applicable, and train in the modern wellness assessment tools. So
Okay,
with
sir.
this, I my presentation.
Thank, thank you, Dr. Nirav Gagatha. It's really a very good session. You really rock the floor with your knowledge and your and how to become a keynote prescriber and what are the merits and demerits of such things and how it can be solved and everything were discussed in a beautiful way. And we need some more presentation as the time there is already over. That's the reason why there is no time for discussion. Anyway, we can have another session with you. You can come up with some of the cases, giving description
Sure,
in
sir.
English and that way, so the people from other part of the world can also understand how you are able to give such medicine and how you choose symptoms accordingly. Anyway, thank you, Dr. Nirav Gangota. And I'm inviting Dr. Rambaresa sir to say a few vote of thanks to the session. Yes, please, please unmute, please unmute. And okay, uh, uh, thank you, sir, for coming over here. And we are very happy to have such listeners also. So we are thanking to all of you in this session. Tomorrow we will have a session from Dr. Bhaskar, Professor Bhaskar Bhatt,
Thank you, sir.
and Doctor will be discussing about India's nutritional program, a step towards a nourished nation. Thank you all. Good night.
Thank you, sir, for providing this opportunity to explain or share my knowledge on the International Forum for Promoting Homeopathy. Thank you, sir.
Thank you. It's over to Dr. Mariama John to moderate the Malayalam session.